and gynecologist, a very enthusiastic person who believes in natural birthing and normal delivery. And today, I really want to thank Baby Chakra for giving me an opportunity to do this live session with y'all and discuss all about monsoons and pregnancy and associated flu and health problems what pregnant women can face during monsoons. So this is my topic for today. And when monsoons come, everybody wants to enjoy rains and have that bhaji and hot tea and enjoy their food stuff, be very cozy at home. But then with all the good things that monsoon bring, it also brings in a lot of flus, fevers, cold, coughs, and a lot of other issues with water that comes in monsoon. And pretty much it is the time for dengue and mosquito and vector-borne diseases, and we are at an attack from the other side. And this is what I really wanted to talk today, because pregnancy is a time when everybody has to be extra careful from whatever precautions that you're taking at home. There are chances of having flu, and nowadays it's all COVID time and COVID has come back. We have to be very cautious in terms of your hand sanitization techniques, your wearing a mask when you're going outside, and social distancing. It not only prevents COVID, it also prevents seasonal flu. And it's very, very important that anybody who's going out from the family where a pregnant woman is, everybody else also should be that careful handling pregnancy at home. And it's very, very important in this season to eat right. Especially you should concentrate on warm food and everything that is warm and hot that you need to take freshly, because in monsoons there are chances of fungus, there are chances of bacterial contamination. Any food that is left over outside and reheated can give any kind of bugs that can cause loose motions and vomitings. This is something that you have to keep in mind. And all pregnant women and all family members, including in that family, whoever is pregnant, should be taking fresh food and do not opt for reheated food. This is something that you should keep in mind. And this is flu season, and anybody with pregnancy has flu. The first and foremost is, if they have mild fever, then definitely they can take paracetamol. If they have mild symptoms of cold, cough, they can use mild anti-allergic medications. But if the fever crosses 100 and there is a cause of concern and every day it is becoming worse, you need to see the physician or the pulmonologist, just in case if any deterioration is seen. This is something that everybody should take care. Why? Because in early phase, you can really curtail the infections. Most of them are viral. Symptomatic therapies work very well. But when the deterioration happens, especially in situations like pregnancy, when the immunity is low, and in children when their immunity status is low, you can have a lot of issues. So going to a doctor and taking advice is of prime importance. And a word about flu vaccines that do work very well. If you have children at home, along with their annual flu shot, it is advisable for everybody to take flu shot, especially pregnant women. And I suggest flu vaccine in pregnancy after the first trimester. That also prevents seasonal flu and also the flus that come in monsoon. And every year the flu shot changes depending on the strains that come in that year. So that's why a yearly flu shot will definitely be helpful, and even in pregnant women it is known to be helpful. And other than this, whatever clothing that you wear should be well aerated, because mold and fungus can develop in dampness, and it is very important that pregnant women should wear loose fitting aerated clothing. Silks and wools and jutes might not be the most friendly fabrics in monsoon. Anything lighter, breathable should be the option. And because of clothes and wetness and damping, you can have fungal infections. It's very, very important to be away from such things. And there is something that really works very well in terms of choosing the right footwear during pregnancy, because your entire gravity is on your feet. And in monsoons there are issues with the feet and swelling of feet, and a lot of issues that we even see by in terms of cracking and fungal infections and all these things. So the footwear also matters a lot. And one small tip that I wanted to give everybody here is, if you have places around your house where water can get stagnated, that's something that you should look into and remove that water stagnation, because vector-borne diseases like mosquitoes can breed in such water holes, and they can cause problems like malaria and dengue, which are very prevalent in monsoons because of breeding. The breeding season of mosquitoes is in and around this time. And it's not only about using mosquito nets in the night. It's always important that you should choose mosquito nets to the windows and doors, main doors, entrance doors, because the mosquito that causes dengue is a daytime biter, and you should keep that thing in mind. It's not about only night, it's about daytime defense also. Kids around in the house should also be protected against mosquitoes. Even a minimal amount of coconut oil on the body can really keep you away from mosquitoes. And for pregnant women, it's very, very important to stay away from any kind of mosquitoes, because any kind of symptoms of fevers related to dengue or malaria or anything that can cause panic in pregnancy, because the platelet counts come down and it can be a cause of concern. And really, I wanted to talk about some tips about food during monsoon. Monsoon is the time that people do like to have a lot of food and experiment on delicacies and all that. But then some foods are really very important in improving your immunity. They give you improvement in digestion, especially the gingers and peppers and turmeric and the home kitchen based spices. These can be experimented, and monsoon food, especially the hot piping foods like bhajis and all these, can also be experimented in moderation if you don't have any other health issues. But then stop eating outside. That's a very good piece of advice that I want to give everybody today. Do not have food that is cooked outside, because we don't know where it is cooked, how it is cooked, how long it has been lying there, and what are the ingredients that they use. It's very important to have a check on that. And I usually prefer and suggest everybody to eat their local food, seasonal food, their traditional food, and also food that is freshly made. And anything that is the craving of the monsoon can be made and eaten at home, and no food whatsoever from outside. And when we are talking about food pattern, when we are talking about vaccination, when we are talking about prevention, when we are talking about treatment, there are some small lifestyle factors that go very long way preventing respiratory tract infections, like doing yoga on a regular basis. If you can do yoga, a small time that you can invest in doing pranayama, and in little more time invest in doing some walking and some small yoga postures that help in pregnancy, your breathing improves, your oxygenation improves, your body immunity level improves, and you will have a lot of positivity and strength to fight any kind of a monsoon related health problem. And it is definitely advisable that everybody in their family should be looking into this aspect and make their exercise routine a priority to save yourself from any kind of an illness or seasonal problems. And one small note that I wanted to talk about is your sleep. Sleep is very, very important. And these days, we are having lower immunity levels because of the decrease in quality of sleep. Maybe if not the quantity of sleep, yes, quality of sleep is little disturbed. Maybe extended time of exposure to blue screen and lot of work related things, stress can be of a concern. But definitely, if you maintain your sleep, your defense mechanism is up, and you will definitely have healthy outcomes. So I think we are having some questions, and we will start questions one by one. So the first question goes: flu and pregnancy care during monsoon. Yes, and if somebody is having flu, as I have told you, um, what precautions is it? Okay, is it safe to take medications for flu during pregnancy? Yes, it is safe for taking medications during pregnancy. Paracetamol is something that is really worthwhile. Anti-allergic medications can also be taken very safely. And because of congestion, the congestion gives a lot of issues. If you can relieve the congestion, definitely it will be of more help. So symptomatic medications for fever and for congestion can be used. A little allergy here and there, you can use a antitussive, but anything that is going beyond, you should stop and consult a doctor. That's very, very important. And what precautions should I take to prevent monsoon diseases during pregnancy? As I have told you, it's all about your immunity. It's all about your health. It's all about your prenatal and pregnancy vitamins that also give a good role in giving you immunity levels. So take your vitamins sufficiently. Take good healthy diet, sleep pattern very well managed, and also do regular exercise and yoga. It will help you a lot building up your immunity. And the next question is, what vaccinations should I take to prevent monsoon flu and disease? There is a flu vaccine that we give to pregnant women. All pregnant women after the first trimester can take flu vaccine very safely, and they can, take it as a single dose. And I usually give it after the NT scan, which is done at 12, 13 weeks. And it does give a lot of benefit against seasonal flus and fevers and all that. And the next question. And in terms of vaccination, even children at home and adults can also take the flu vaccine along with the pregnant women. I'm 5 months pregnant and I'm suffering from flu. Besides medication, what care should I take? You should be taking, warm food. Make yourself comfortable. Do a little bit of breathing exercises. Warm food does help a lot. And if you have any throat pain, you can have some gargles with salt water. That's the most beneficial thing. You can have some soups and liquids that are warm enough and give you relief from congestion. If you can sip in hot water on a regular basis, any viral infections in the throat will die off, and it will be a very good, beneficial thing. And what home care should I take to boost my immunity during pregnancy to prevent monsoon diseases? It's about home food, and eat seasonal, eat local, and eat traditional foods. And follow your grandma's nuskas, like including ginger in food, like pepper with milk and turmeric with milk. These are some concoctions that really help improve your immunity. And you have a spice box that really helps you in the long run. And have foods that are really made for the season, and they will definitely help you improve your immunity levels. Yes, there are chances of dengue during monsoon, because this is a time when you have lots of lakes of liquid, water everywhere, and dengue mosquitoes breed in that fresh water. And that mosquito is very notorious, and it's a daytime biter. You will be very careful while sleeping that you have mosquito nets on and everything else on. But during daytime, we might be a little careless about ourselves. So make sure that you're vigilant about mosquitoes and clean up all the mosquito breeding places in and around your place, and make sure the entire society is also looking into that aspect. And is it good to eat delivery in monsoon with stitches healed properly to get delivery? Obviously, see, our babies deliver 24/7, all seasons, all throughout the year. So, and stitches heal well if the mother is taking good nutrition, good medications, and good prenatal vitamins, and taking adequate rest. In monsoon, what we all do is we take less water. This is one thing that I wanted to tell. If you take lesser water in monsoon, definitely you're more likely to get urine infections and vaginal infections and all that, because infections can creep in from one system to other. So it is very important that you take a lot of water and then keep yourself hydrated, because thirst per se is very little lesser in monsoons. So that is how we get more urine infections and vaginal infections because of fungal yeast and all these infections. So you have to be very vigilant about that. And delivery, any season, it's fine. It doesn't affect the sutures. Um, if you are taking very less water, you can actually uh, you know include foods that have water. Like, in our South Indian, we have rasam with food, and we have sambar with food, and likely in other places there are soups that, traditional soups that are made to have. And whenever you want to have, you can have some hot water. You can have some spices that have been put and then boiled, so that that water also can be taken on a regular basis, especially cinnamon water, especially clove water and jeera water, kind of a thing. They are very, very healthy, soothing, and also intake of liquids is also very easy. And to include a soup on a regular basis in the evening also makes a lot of sense when you want to really include the water. And irrespective of thirst, make sure you have a bottle of water next to you, and you sip water on a regular basis, even in monsoon, because this is something that you have to be little vigilant on. So, any questions? Yes, and my takeaway message for today is hydration is very important. Flu vaccine is important in pregnant women. Pregnancy means extra care, and care comes from home, and home made food is giving you a lot of immunity. Do take care of your health by doing yoga. Do take care of your health by having organic food. Invest in yourself and live life sustainably. Sustainability angle gives a lot of benefits. Not only it gives you immunity, it also keeps you away from a lot of ill health and seasonal problems that come and creep in. So our immunity is in our hands. Let us save it and definitely build our strength and go forward with health. So I am currently at Kim's Cuddles Mother and Child Center, Kondapur, Hyderabad. I'm an obstetrician and gynecologist, a passionate person to do normal deliveries, and I encourage vaginal deliveries after cesareans, breech deliveries, and normal deliveries even in twins. So that's my specialty. And thank you, Baby Chakra, for giving me an opportunity to talk and have a very good lively session about pregnancy, flu, and monsoons. See you, and bye bye.